those that don't know what the Public Health Network is, can you explain to the layperson and viewers out there what exactly that entails and what that is in a nutshell?
In a nutshell, okay. There are 13 public health networks in the state of New Hampshire, and we're one of them. They are all funded by the Department of Health and Human Service and the Bureau of Drug and Alcohol Services. And we all have a mandate to establish community health improvement priorities and to map action plans and evaluation plans towards those so that we work on projects, we try to move the needle on health issues, on substance misuse prevention, and report back to the community on progress as we go.
Thank you all for coming. My name is Jeff Jonathan. I'm the CEO of Parkland Medical Center. On behalf of Parkland Medical Center, I'd like to just take a moment to thank all of you for being here and marking the one-year accomplishments of the Southern Central New Hampshire Public Health Network. Over the last year, the Public Health Network has had 5 areas of focus, which include public health emergency preparedness, injury prevention, substance misuse prevention, behavioral health access, healthy eating, and active living. This would not be possible without the leadership provided through many of our community agencies and the representatives such as the Granite United Way, Center for Life Management, the Community Alliance for Teen Safety, Greater Derry Community Health Services, and Parkland Medical Center. Please join me in thanking our partners for the leadership and working to keep our communities healthy and safe. So today we will hear from Patrick Tufts, President and CEO of the Granite United Way, Joe Harding, the Director of the Bureau of Drug and Alcohol Services, Donna Tai, representing the Public Health Advocacy, Public Health Advisory Council, and Shannon Breshaw, the Vice President of the Public Health Network and the Granite United Way. Before we begin, we do have representatives of the state senators. So Chris Scott from Senator Shaheen's office, and Meredith Shevitz from Maggie Hassan's office. So I'd like to ask them to come up.
Thank you and good afternoon. Unfortunately, Senator Shaheen was unable to make it here this afternoon. They're both in Washington working on our behalf. But she did send along a letter that she asked me to share with you here. So if I may. Dear friends, I send my best wishes to everyone gathered here today to celebrate the good work of the South Central New Hampshire Public Health Network. Please know that I am with you in spirit as you reflect on the network's role in delivering effective health care to each of the communities you serve. Your accomplishments are the product of a focused effort that joins key community leaders with private organizations who specialize in the delivery of effective health services. Thank you to everyone whose hard work and dedication over the years has shaped the network into the valued community resource it is known by today. Your approach takes a broad view of the health needs of the population and then finds the means to strengthen public health as effectively and as efficiently and as cost effectively as possible. You do so by building a network of professionals who educate each other and the community on pressing issues concerning public health. In particular, the efforts of groups like the Center for Life Management and the Community Alliance for Teen Safety have been critical in crafting a comprehensive response to a substance use crisis that is devastating towns and cities across the state. Their work is a prime example of the community recognizing a public health problem and then coming together to propose practical solutions. Today's event is as much about celebrating the past as it is looking forward to the future as we continue to look for ways to strengthen public health. I applaud the South Central New Hampshire Public Health Network for your years of advocacy and tireless work, and I wish you all the best as you continue your important endeavors. Sincerely, Jean Shaheen, United States Senate.
Bit shorter here. So as Chris said, both Senator Shaheen and Senator Hassan are down in D.C. Right now, but so the senators, sorry she couldn't be here, but asked for me to be here on her behalf. So, dear friends, I regret that I could not be there in person today, but I would like to join you in supporting the critical work of the South Central Public Health Network. At a time when the very fabric of our healthcare system is under attack by some in Washington, and our state faces its greatest public health crisis in decades, initiatives like this public health network take on new significance. One of my favorite things about New Hampshire is the all hands on deck ethos of our people. We roll up our sleeves, pitch in, and together we move forward. I greatly appreciate your willingness to devote your time, energy, and expertise to improving the health of our communities. From continuum of care for substance misuse to community health planning to emergency preparedness and injury prevention, the organizations that make up the South Central Public Health Network provide leadership across the full spectrum of public health. This leadership will continue to aid in the coordination and facilitation of efforts to improve access to quality, affordable health care for all Granite Staters. Please know that your service has made and will continue to make a real difference. With every good wish, Margaret Wood Hassan, United States Senator.
Thank you, Chris and Meredith. That was great. You know, today everybody talks about, you know, what they're against and what they don't support, and today is all about what we're all for. And I think we all agree with the comments from our senators that we're all positively together in the same room. This is a first for our region. We're all here because we're for something, improving the public's health in this region, and that's tremendous. Our first guest today actually is kind of our boss, if we think of it in this way, but Granite United Way acts as the sponsor and leadership agency for the South Central Public Health Network. And we're lucky to have Patrick Tufts, the CEO of United Way, along with a lot of sirens, here to talk to us a little bit about United Way's investment in this work here and throughout the state. So, Patrick?
Thank you, everybody, so much for being here. And United Way is nobody's boss. Thank you, Donna, for acknowledging our role in this important work. I'd also like to thank Senator Hassan and Senator Shaheen for their support of New Hampshire and all of the public health networks and the work that's being done in our state. This was new work for United Way. When it was posed to us, would United Way be interested in doing public health and substance misuse prevention work in the greater Derry community, Derry and Salem? We had to think about how to best deliver that. We're not a service provider. We're a problem-solving organization that values programs and initiatives in the learn, earn, and be healthy space. But when we looked at the opportunity that was in front of us to work with the great agencies that exist in this community to pull together an effort that would work in unison and work united to address some of the most serious problems in our community, we went back to our partners at the state and said there's one way that we would do this. We would do it if we could completely subcontract out all the work to Derry and Salem-based agencies. And we felt that they had the boots on the ground, they know their community better than anybody, and we were the first organization to hold one of these grants that subcontracted out all the work. So I want to congratulate the Greater Derry Community Health Services and Donna, Parkland Medical Center, the Center for Life Management, and the Community Alliance for Teen Safety for partnering with United Way in a completely new way of looking at doing this work. All of us partner, all of us collaborate. We know how important that is, but it ain't easy. And it's really not easy to get multiple organizations rowing in the same direction, but that's what we have to do if we're going to make the best use of the resources that we have. United Way's role in this is to provide the administration, to be the helping hand when we can, some marketing and some resources to help make sure this happens. But the work's getting done here in the community by agencies located in the community, and I think that's why this has been successful. A couple of quick announcements. Very happy to announce that the team is growing with the newly approved grant. The Upper Room will be joining the Alliance as a funded partner and a subcontracted partner this year. I think that's great. Another local organization doing great work here in the community. When I was talking to Shannon as we came in, you know, one of the things Shannon does is she's very modest. And we were talking about the proposals to the state for this work. And if you think about where we were 2 years ago, pitching something that hadn't been done before, in a community that it hadn't been done before, with United Way that doesn't have an office in Derry, you know, being honest, to the fact that in last week's approved contracts, this region had the #1 ranked proposal out of all 13 public health networks. And I think that that's a testament to the collaboration that's going on in this community and how you're all coming together to work together on behalf of the citizens of your city, towns, and local region. So my job today is really an easy one. It's to introduce Joe, I think, but other than that, to say thank you. There's a lot of people here. There's a lot of enthusiasm in this region. Thank you to Parkland for hosting us today, Jeff. And I really look forward to United Way just being part of the team as we do even more great things here in Derry and Salem and all the surrounding towns. So thank you for your collaboration. Thank you for your trust in each other to do things in a different way. So I'd like to turn it over now, introduce Joe Harding, the Director of the Bureau of Drug and Alcohol Services, who's really just another guy who's got his boots on the ground, knows what's going on in the state, and is just a wonderful resource for New Hampshire. So, Joe?
Thank you, Patrick, and I'd like to thank everyone for inviting me here and all the partners. And Derry's a place near and dear to my heart. I lived here for about 10 years before I moved to Chester about 20 years ago, and so I know there's a lot going on here. We're still very involved in this area. You know, I'm here to talk a little bit about the substance misuse scope of work under the Public Health Network, and so I want to tell you a little bit about what the idea is at the state level and what we're trying to do in partnership with each of the local regions. And I should start by talking a little bit, you know, everyone knows we're facing an opioid epidemic in the state. We have something like 110,000 people in New Hampshire that have a substance use disorder. We know that admissions for into publicly funded treatment programs, about 10 years ago, about 17% of total admissions for opioids, for heroin and prescription opioids and fentanyl and that sort of thing. And now they're more than 50% of our admissions. We know that over the last few years, emergency medical services have responded to provide naloxone has gone up from 1,000 times, which is a big increase from years before, to over 3,000 times across the state. And that there were over 6,000 visits to emergency departments across the state as well, which is really tying up the resources in those departments and really impacting the medical care that other people that are going to an emergency department for emergencies. But substance use is also an emergency sometimes. We know the worst statistic of all is that drug overdose deaths increased from 163 in 2012 to 438 in 2015 to 476 in 2016. With all of these statistics, I really need to stop and think about, these are numbers, but what this really is people. And these are people in the community. As I drive through the community, I have to stop and make myself do this, because otherwise the tail can start wagging the dog. You know, these are people in the community. These are people that are showing up at the Parkland Emergency Department. These are people that are showing up for different services. These are people that are impacting the crime rate in the city. These are people that are impacting everything that's going on within the city. And they're desperate and they need help, and I want to thank everyone for coming together to do the work that you're doing. You know, I want to provide a little bit of a contextual framework for some of the things that we're doing. So what we're trying to do through the regional public health networks is is really to promote a comprehensive approach to addressing the misuse of alcohol and drugs across the state. And really that's a public health approach that takes a look at data and information from the community to say, you know, what's the prevalence, what's the impact, how's this impacting individuals and families and business and hospitals and different institutions, and then to develop a plan, well, first actually taking a look at what's the capacity on the ground to address these issues, what are all the different resources, and then developing a plan to be able to do that. So that's really been the charge of the regional public health networks, and you know, doing the assessment, the capacity, the planning, and implementing it, and then making adjustments as you go along and evaluating the effectiveness. And we really talk about a comprehensive approach. So that includes population level strategy. So that's anything from laws and regulations, you having safe prescribing practices among your medical providers in the community, have safe storage and disposal for prescription drugs. It's really having access and capacity for services. It's public awareness campaigns to let people know about the risks associated with the misuse of alcohol and drugs. And it's really convening community stakeholders to do exactly what you're doing here today and what you've been doing over the last year. You know, a lot of times people talk about what's Washington going to do about that, or what's Concord going to do about that? And you know, there's a role for Washington and there's a role for Concord, but really all this has to happen in your local community. This is where the people are, this is where they need help, this is where they need the services, and this is where they can find recovery. So again, applaud you for all your work. So, you know, we are trying to, in addition to population level strategies, we want this continuum of services. So we have prevention services that target individuals that are at particular risk. So we know that kids that are coming from homes with active addiction or serious mental health problems, or kids that are experiencing academic problems at school, or behavioral problems, or dropping out of school, or people involved with the justice system, people with a history of trauma, we know they're at much greater risk. So we're trying to put out prevention services that are targeting those groups that we know they're at particular risk. So for example, we're putting prevention services in place for parents who are involved with our Division of Children, Youth, and Family Child Protection cases whose parents have an identified substance use disorder. So their children, who we know are at risk, are going to get prevention services to try to reduce the likelihood that they'll go on to misuse alcohol and drugs and have a problem themselves in their own lives. And then we have early intervention to try to, usually in medical settings, to try to intervene early to identify if somebody's starting to misuse alcohol and drugs before they start to progress towards addiction and all the consequence that goes with that. And then we have an array of substance use disorders treatment services that we're funding across the state. A lot of people think that when you're talking about substance use disorders treatment, that's a 28-day program. That's a real misconception. That it's like any other health condition. It really depends on the level of acuity and the circumstances in a particular person's life. Some people may do well with outpatient or intensive outpatient, or different levels of residential. It really depends on the circumstances. And then something where we've had no capacity in the past, but we've done a lot of work, is recovery support services. So you can have this big investment in making substance use disorders treatment services available. Spend 3 weeks trying to get somebody into a place, and 10 hours later they're blowing out because they haven't had medication-assisted treatment. So medication-assisted treatment and recovery support services to help people maintain their recovery after they've gotten some help. Now, the other thing we're doing, and it's really key to the work that you're doing here, is we're not doing any of this as funding disparate services that, you have a treatment place over there and a prevention place over there, and never the two shall meet or talk or do anything. It's really about trying to coordinate. We call it a recovery-oriented system of care. It's defined as recovery-oriented systems of care are networks of organizations, institutions, community members that coordinate a wide spectrum of strategies and services for prevention, early intervention, treatment, and recovery. Sounds a little bit like what you're doing to me. It's remarkable what I've seen in this community. A lot of people have heard about Safe Stations in Manchester, and Nashua has adopted that program. They came together and are doing some great things, but that doesn't work for every community. So what we're trying to do is bring resources to the community for you to figure out with what's here on the ground, and for the people here that know the community and know the resources and develop those relationships, figure out a way to make this work in your area. There's some information that talks of, I don't know if you've gotten it, but provides kind of a graphic of what we're trying to do in each of the 13 regional public health networks across the state. So we're trying to fund a lot of this work. We're including the positions that are under the regional public health network. Kate McDonald and Adam Birch's positions to try to be a resource to your community to come together to address these issues. Lastly, I just want to mention that I think some of the most challenging work ahead of us is exactly this, is convening people. And then we also have challenges on the ground. We have a lack of resources. Over the last few years, a lot more has been made available in the way of benefits for substance use disorders under public health benefit plans or private insurance plans. But there's still a very much a lack of resources or capacity for services on the ground. So, and then there's also a lot of challenges on an available and skilled workforce to work in those programs. The people that are in the audience that work in those programs know all about this. So we've put out about $30 million over the last year or so, and a significant amount of that funding was actually to develop capacity in each of these areas. So with that, I'd like to close by, again, just thanking you for all your work, and please keep it up. And this is really requiring a partnership at the state and local level, and thank you.
Thank you. You guys didn't warn me. This sort of slopes down a little behind the podium. I just almost fell over. That would have been dramatic. My name is Donna Ty, if I didn't introduce myself before, and I work for Greater Derry Community Health Services, and our responsibility is to provide leadership for the Public Health Advisory Council and support to each of the scopes of work under the Public Health Network umbrella. I was asked today to talk a little bit about our accomplishments, and I feel like I should sit down because this is an accomplishment. I'm really excited to see this number of people who've come together in a room to talk about what's going on in our communities, who have concerns, who are proud to be a part of the work, who are just interested consumers, neighbors, and friends, or who are the professionals who are not covered as a part of the public health network under each scope of service, who still put their time, energy, talents, and efforts into solving the problems that our community is facing. Those are our first responders, the leaders in our school districts. They're the clergy, they're our representatives and our council members and all of the people who aren't earning a paycheck from the public health networks, but nonetheless are still doing a ton of the work in the communities, and we thank you very much for the work that you do. It's hard to believe that we're a little over a year old because it feels to me like the time has gone by in a blink. And much of the early days was laying the groundwork, developing our first ever community health improvement plan, and identifying our priority action areas. When a network first comes together, we're required to conduct a community assessment, look at our community data, and come up with a community health improvement plan. There are two mandated areas of a community health improvement plan, which are substance misuse prevention and public health emergency preparedness. And we're really, really lucky to have talented and dedicated organizations in charge of those areas. The three other areas that our region, based on the data we worked with the Center for Excellence and community partners to collect the data, were injury prevention, healthy eating and an active lifestyle, and behavioral health access, which for all intent and purposes today is being addressed through the work on the Integrated Delivery Networks, or IDN. These three areas, in addition to the mandated areas of work, are essentially unfunded. And when Joe talks about the lack of resources, it falls to our community to roll up our sleeves and figure out the way to make the work happen. And we're really, really fortunate here because when the call to action went out for work groups in our areas under self-harm prevention and healthy eating and active lifestyle, people stepped up. Angela Boyle from Community Crossroads is leading our healthy eating, active lifestyle work group. And Sue Sentner has actually been providing a lot of direction to our self-harm prevention work, but Celia Felsenberg has been very involved in that as well because it's part of work that they're very passionate about in addition to being involved in other scopes of work. I feel very blessed as the director of an agency to work with the people that I'm able to work with through the Public Health Network. It's huge that Granite Pathways is now in our community, and we're developing relationships with them around the services that they're providing at the Derry Friendship Center. It's it's a blessing that we didn't expect to see happen in our first year of operation, and it's wonderful. What we have done in terms of accomplishments, there's a list in your program if you didn't have a chance to read it, so I don't need to read to you, but the highlights are that we did complete our community health improvement plan. We do have a website, and the website is listed on the back of your program, where you can certainly look, and you can read all about each scope of work and what the action plans are in those areas. We have social media, we have lots of ways to interact with us, and we have phones and emails. So you should always feel free to contact us, because everyone is welcome. This isn't a table that's set for 4 or 12 or 20. It's an open forum where we want to talk to you all about what it is that you want to see done in the community, what's important to you, what makes you feel your heartbeat faster, and what do you want to be involved in. That's one of the most important parts of the work that we do, because it might not even be on our radar, but our community health improvement plan is a living document. It's something that we will change and amend, and it will grow as our community grows and as needs change. Absolutely. Today, we are looking at substance misuse prevention with a very, very close eye, because it is the community crisis. And if we were the South Central Public Health Department, we would have to be crafting a response to a public health emergency, and that's what the substance use disorder situation is in our community. So I welcome you all. I'm really excited to see you all here today. I know many of you. I don't know all of you. If I haven't met you, feel free to come and introduce yourself. Pay particular attention to the back of your program. It has the best ways to contact us. Don't ever hesitate. If you're having an event, shoot us an email. We're happy to come. We're happy to help promote it. We want to see our partners doing well at the work that they do. And that's really critical to all of us who are engaged in this. I don't have a lot of other things to say, because that's all I can say, but I am going to introduce Shannon Breesaw. Shannon is going to speak to us about her field of expertise with us, because she has lots of experience with us day to day so far, and is actually involved with the Governor's Commission. So, Shannon.
Thank you. Hi everyone, my name is Shannon Breesaw, and I'm the Vice President of Public Health for Granite United Way. I also serve as the contract administrator for Granite United Way for this contract that we hold with DHHS for the South Central Public Health Network. I've been working with public health networks in the state since 2004. A lot of my focus has been on substance misuse prevention. So as Donna mentioned, we're dealing with an opioid crisis in our state. It's the most pressing public health problem that we have. And so certainly, a considerable amount of our time is focused on that. I serve as I serve on the Governor's Commission on Drug and Alcohol Abuse, and I also serve as co-chair of the Prevention Task Force. That entity has good representation from the South Central region. The other chairperson for the Prevention Task Force for the Governor's Commission is Tim Lena, who many of you know, student assistance counselor at Timberlane School in Timberlane School District. So we try and really bring information from these communities to really talk about how substance use disorders are impacting this community in particular. So I just want to kind of go over some additional outcomes that we've seen in this region since we first came together a little over a year ago. So over the past year, the network has engaged over 200 volunteers and key stakeholders across the various priority areas that Donna and others have talked about. We had a survey where we asked key stakeholders about what some of the most considerable outcomes are of the public health network, and they talked about having an increase in community connections, expertise on different public health areas, the data resources of the network, having a shared mission and goal in the region, and also bringing together diverse stakeholders to address all of the priorities we've discussed. So those are some of the outcomes that, in addition to what is in your document, I'll just highlight some of the other areas around our public health emergency preparedness. We had a resurgence of our Medical Reserve Corps in this region, so volunteers working to make sure our communities are well prepared in case of a public health emergency, and that work is being coordinated through Parkland Medical Center. In terms of some of our other priority areas where we don't have funding, we are constantly looking for resources to impact the areas of our community health improvement plan that we've identified. So if we don't have the resources, we're looking for resources. So we did submit a funding request to focus on some strategies related to healthy eating among youth 0 to 5 and their families. We weren't successful in the proposal. However, we have a plan that we put together that I think we can still work on and also look around to see if there's some other resources that we can bring into this region. But we're always kind of looking for those opportunities to bring in resources and then put them back out into the community with partners that we know can take on those scopes of work. So as others have said, much of the work is focused on the issues around substance misuse, the opioid crisis. At the state level, as I mentioned, I'm on that Governor's Commission Task Force. We have just put forth recommendations for the Commission for a statewide plan to address the substance use disorders across the state. In terms of prevention, we're really learning from our communities. As I just mentioned, we're learning that we have to take more of a lifespan approach. I think a lot of the work that's been done in prevention, in particular in our state, has focused on the middle school and high school age categories. And really, we know from research, there's such strong research out there that shows the impact that you can have at the 0 to 5 age group in terms of impacting later substance misuse. We know that adverse childhood experiences, things like violence, abuse, neglect, even, a death in the family, things like that, have such a huge impact on young people, and it really increases their risk for later substance misuse. So we really know that that is an area that we can have such a huge impact in. So we're looking to increase our focus there, and I know in this region in particular, there's a lot of interest in doing that. So we try and bring those recommendations forward at the state level. We did another survey of key stakeholders, and 64% of key stakeholders in this region stated that their involvement with substance misuse prevention has increased over this past year. Over 95% of those surveyed stated that they believe there's been moderate or great progress in addressing substance misuse in the past year in this region. So we're really happy to see that. As others have stated, we've worked with other organizations on the Narcan trainings and dispensing events that have been really well attended in the region. We've also worked closely with the prevention coalitions that we have in the region, Stand Up Salem and the SOROC Coalition. And we worked with Stand Up Salem in particular. We're active participants on their steering committee. We worked with them to write and submit a federal grant request for $625,000. I have this bug coming after me as I'm talking. So we put in a proposal. It would be $625,000 over the next 5 years through the Drug-Free Community Support Program, which is also a funding source for the SOROC Coalition. And we'll find out end of August, beginning of September. But this included the development of a comprehensive action plan in the Salem area with a focus on preventing substance misuse, working with 12 community sectors. We're also working with Stand Up Salem and the SOROC Coalition to bring in some training. So we're using some of our resources with the Public Health Network to bring in some national trainers through CADCA, which is basically the go-to as it relates to substance misuse prevention. So we actually have a training tomorrow in Salem and one coming up soon to work with SOROC, but really to provide that level of technical assistance and support that will help the communities do the work on the ground, the grassroots work that coalitions do. And then just, in terms of other successes, we've worked closely with school district. We've worked on, I know Sue and Katz have worked to help with the implementation of the second step prevention curriculum in schools in the region. So we're out there. We're trying to get out there more and more. But there's significant work happening. And I just looking at this, I also oversee our contracts that Granite United Way holds for the Capital Area Public Health Network and the Carroll County Coalition for Public Health. And those groups have been in existence for a while. So just know that for a group that just came together over a year ago, the successes have really been tremendous. And that really is a testament to the work that the subcontracted partners have done, but also, as Donna mentioned, all of you in the room and those of you that have contributed to all the activities that the network has been part of, because our staff hasn't necessarily led everything, but we're there hopefully to support and provide the resources necessary to do this work. So thank you. And I think I'm handing it over to Sue.
I'm gonna wait a minute.
Okay.
Don't go away. Thank you. We just wanted to give Shannon a little something because we would feel lost without her pretty much 4 out of 5 days every week. I think her email must blow up from all of us saying, should we do, how should we do, when should we do? And she's really provided the roadmap, and it's been awesome. And so this is up to you. Thank you. I'd like to introduce Scott Haggart. Scott's a member of the Public Health Advisory Council. He's a battalion chief with Derry Fire Department, and he's going to be presenting a special award today. And Sue is with him. Okay.
My partner in crime here, Sue. So on behalf of the South Central Network and the Public Health Advisory Council, we wanted to recognize the Derry Friendship Center and the countless volunteer hours they've provided for our recovery services in our community. And there's a plaque here that's from the Granite United Way.
Would some members of the, it does look back, oh my goodness, thank you. Some members from the Derry Friendship Center would like to come up and join us. Carol Bowden, who is the chair of the Derry Friendship Center Board.
Thank you. Great, thank you. You know me, I like to talk. So anyone that knows me knows I like to talk. Thank you so much. We're so humbled for this because for those of you that don't know anything about the Derry Friendship Center, we've been in the community for 35 years. And 3.5 years ago, we were fortunate enough to get our own building on Railroad Ave. We moved from downtown, which to many members in the community, I think they were happy about that because the original location looked a little sketchy, to say the least, but no one realizes the work that goes on inside the room. And I think that we're very humbled today that the community itself recognizes the importance of recovery support services and that the Derry Friendship Center is finally being recognized as a resource for this crisis that we're having in our state today. And if you haven't gotten your little insert, I'm going to put a plug in for this afternoon. We're having an open house at the Derry Friendship Center. So come on by if you have the time and see what our building is all about. You know, come on in. We've got fruit and cookies too. So thank you so much for this.
I forgot to coordinate who would moderate the questions and answers, but we can call upon our speakers. If anybody has any questions about the material that was presented today or would like to make any comments, would be happy to entertain those. Yes?
What are some of the gaps that still exist presently for people who are suffering from substance misuse? Say if there was if there was an emergency or an overdose and they called the fire department, what would happen with that person?
I would probably turn that over to a first responder who would answer that question for us. Scott, Chuck, anybody?
Well, good afternoon, folks. My name is Chuck Hamby, and I'm the EMS director here for the Derry Fire Department. So, great question. What do our boots on the ground, our troops, our EMS providers, our firefighters, our first responders do when we encounter someone with substance misuse disorders and we're called to their aid. We immediately respond. We treat them to the best of our ability with compassion. We encourage a transport to the emergency department. Unfortunately, I feel we have a lot of gaps in the community as far as extended services and where do we go with those individuals. It's pretty sad when someone presents to a firehouse and they're asking for help, and we really struggle to try to find resources. We've pulled together a coalition of community partners, and we've worked for well over a year trying to address some of these services and try to come up with some solutions and where we can direct folks. And we found the Friendship Center here available here in town, and now the Granite Pathways is available Monday through Friday from 9 to 5. We have access to services here in the greater Derry area. This is something that we've been praying for a long time. It's very difficult when we're faced with these scenarios in which we don't have great answers and great outcomes. You know, we've seen patients that have been seen in the emergency department and discharged, and they come to the fire station looking for help. Maybe there wasn't services available for them there. So we're all working together as a group. We're trying to find solutions to very difficult and very complicated problems. And we've seen our coalition grow over the last year, and we're reaching out. And hats off to the Friendship Center, because now with Granite Pathways and their RAPS representative, we have a resource, a very valuable resource in which we can direct individuals. They can get that face-to-face contact, and hopefully they can get the services and the help that they need. So thank you very much to the friends at the Friendship Center.
Anybody else have any questions or comments they'd like to make? Phyllis.
Thank you. Yeah, just a comment. I look around and it's all the key people and organizations in this town, but I don't see any of the clergy. They, meet with all the kids and the young people and the people that have problems with drug and alcohol. I think it would be nice if you could invite the clergy to come, the different churches, and if they're too busy, they could always send a representative, but I think they're in contact with the people all the time, and the people go to them for help. And just a comment and just a suggestion.
No, I think it's an excellent suggestion. Thank you very much. Is there anybody else that would like to make a comment or say anything?
We do work with a person in the faith-based community. She represents a lot of regional work groups. Pastor Natalie Larson, she's actually on part of our work groups to help kind of integrate some of those youth-based, faith youth-based community around S&P. So we're making some inroads in that area, but
Thanks, Matt. You're right. I forgot about Pastor Natalie. I'm really sorry, because she is a member of our Public Health Advisory Council as well. With no other questions, I certainly would encourage you, if you have the time, to please go over to the Derry Friendship Center, see where Craig works, see what's going on over there, how you can access resources for yourself, for a friend, for a relative, for anybody that you know, or someone you might come across. Chief Gagnon.
Hey there, how are you?
Good, how are you?
Good. My name is Mike Gang, I'm the fire chief. We talked before about having a RAPS representative in the Friendship Center during the daytime, during the week. How long is it before Derry is going to see 24/7 services in Derry that we can reach out to? Because these people that need it, they need help. They never come in during business hours.
I think Kim Haney is from Granite Pathways, and she might be the best person. If you want to come up, Kim, you can be heard by the room.
Yeah, sure. I'm actually going to be speaking at the Derry Friendship Center next, so if you can come over, you'll have a chance to hear a little bit more about our program. Craig is positioned there Monday through Friday, 9 to 5. However, we do have somebody on call 24 hours a day. So they may not be able to see him face-to-face after hours, but we'll still be able to do the screening, talk about resources, and follow up with them on Monday morning when Craig is there, or the next morning if it's during the week. So we always have somebody available by phone. You're welcome.
Just to follow up on his question, do we know when, how long it will be till there's someone there 24/7?
I don't have an answer to that.
Are we working towards that?
I don't know if there will be somebody 24 hours a day in person or not. I can certainly look into that. It will kind of depend on contracting, funding. That's definitely beyond my scope. So, but there is somebody by phone 24 hours a day. Yeah.
The chief seemed to indicate that the majority of the need was not during daytime hours, or nighttime hours. Has there been any thoughts about maybe changing from 9 to 5 to 5 to midnight?
That's a great question. The reason that we do it the way that we do it is because with the people that call, we do a screening with them, and then we call resources with them. So a lot of the resources are not open at night. Again, that's why we have somebody on call during the off business hours, so that we're making sure they're still being able to contact somebody and have that discussion. If they're in a crisis, we walk them through that crisis and the resources that are available immediately. However, when it comes to some of the work that we do, it really is reliant on other agencies and resources being open to be able to make those phone calls and contacts with them. So if somebody calls at 9 o'clock at night, we'll still have that contact with them. We'll do that screening. We'll discuss some of the resources available to them, and then we'll schedule a time the following morning or on Monday if it's during the weekend of what those resources are that we can call together. So we conference call those resources and we make sure they get connected. So I can definitely explain that a lot more at the next meeting.
Thank you,
You're
Kim.
welcome.
I really appreciate it. And Kim is going to be at the Friendship Center immediately following this with her band of brothers and sisters. So we're happy. I'm sure that they'll be able to speak one-on-one with any of you that want to go over there and chat with them. You know, we all have to walk before we can run. And I think, you know, having a presence, I mean, we are fortunate to have a presence for Granite Pathways at the Friendship Center. And they've so generously hosted the agency to come and be located there that I think, you know, it's step one. And, you know, we all have to start somewhere. And we have to assess what the resources are, what the manpower is, what the capacity is to staff it. And, you know, the agency itself has to look at what it can do for us. And, you know, you can always call someone. I mean, they don't call it anyone, anytime, or anytime, anyone for nothing. You really can reach people in the middle of the night if you make a phone call. People do call you back. We have firsthand knowledge of people getting their calls returned and speaking to people. So it really is a resource. And, you know, you're right. When people decide they want to make a change, it could be 4 o'clock in the morning. And maybe there isn't a human being to sit with them, but maybe there is someone who will stay on the phone with them and talk it through and do an assessment and give them some time. And if you're hanging by a thread, maybe it'll hold you over till the next morning. Thank you all so much for coming today. I really appreciate your time and attention. Thank you to Parkland for hosting us and to all of our partners for coming.
Kim's here today to speak to us more about her involvement with the Friendship Center and what this particular event means to her and the Friendship Center as well. Kim, thank you so much for speaking today.
Hi, thank you for having me.
Well, thank you. So can you tell us more about the Friendship Center and how it plays a supporting role in the opioid crisis?
Sure. So I am the supervisor with Granite Pathways Regional Access Point Services, and we have a satellite office in the Derry Friendship Center. And so the person, Craig Barnaby, that is there Monday through Friday during the week, and we help people access treatment.
Excellent. So what does an event like this mean to you guys there?
It's really pretty amazing to see the community coming together, and everybody's really working really hard on pulling together resources and getting people the help they need.
Excellent. So what do you hope to see happen within the next year?
I hope to see our program grow. I hope to see more satellite offices in more regions just like this, and we'll be able to help more people.
Excellent. So if people want to contact the Friendship Center, what is that contact information?
So they can contact Craig Barnaby, who is a RAP specialist at 603-931-3700.
Excellent. Thank you so much, Kim.
Thank you very much.
I'm here with Eileen and Colleen here to talk to us today about the emergency preparedness arm of the supporting role that they play with the opioid crisis. So Eileen, can you talk to us more about what your role is?
Yeah, the hospital plays a part in the South Central Public Health Network. We're really the emergency preparedness support for the efforts of that. They also have a substance misuse program as well as continuum of care support. So our role as a hospital with regard to the opioid crisis is similar to the roles we've played in the past, which is managing the medical needs of patients as well as the behavioral and psychological needs of patients who are suffering and families with substance use disorder.
Excellent. Thank you so much. And Colleen, can you explain to us more about your role?
I'm the Emergency Preparedness Coordinator, and through my role, I work with the partner agencies in the community, and we prepare and plan and train in case of emergencies in the area.
So, what do you hope to see over the next year?
You know, I think we had some good discussion about the RAPS program. I think the RAPS program is a great way for us to provide resources at a point in time when patients and families really need them. So, glad to be partnering with that.
Thank you so much. Anything else you'd like to add?
Working and regional partners have been great through all aspects of the scope of work through the network.
Thank you, ladies, so very much. Shannon, thank you so much for speaking with us today.
You're welcome. Thanks for talking with me.
Yes, well, why is this event so near and dear to you?
So I serve as the Vice President of Public Health for Granite United Way, and we oversee the contract for the South Central Public Health Network for the state. And we're really working on those crucial public health issues that not one agency can address. So an issue like substance use disorders, it's something that requires a really complex approach, and you really need to involve people from all different sectors of the community. And so that's why an event like this is really important, because it does that. It brings people from all different aspects of the community together to talk about what's going on. So that's why it's important.
So can you speak to us as to the work that Granite United Way is doing?
Sure. So Granite United Way basically serves as the fiscal agent for the network. We are the host agency for the network. We also serve as the host agency for 2 other public health networks across the state. And so with that, we provide leadership and coordination and really just trying to bring in the resources so that the agencies in this region on the ground can do the actual work. So we provide some of that coordination and really the administrative support so that the actual work can get done and that the agencies we partner with can focus on the actual work and they don't have to focus on some of that administrative oversight piece.
Well, how can people help or contact you?
So if you go to the website of the South Central Public Health Network, which is southcentralphn.org, all of the contact information for each scope of work is available on the website. And so whether you're interested in getting involved in emergency preparedness or substance misuse prevention or serving on the Public Health Advisory Council, you can find out all of that information on our website.
Well, it sounds like there's a variety of ways for people to plug in. So thank you so much, Shannon. With me, I have Sue from the Community Alliance on Teen Safety. Sue, thank you so much for talking with us today.
Thank you. I appreciate the opportunity.
So can you explain to us the role of CATS in this public health network?
Yes, thank you. CATS is a subcontracted partner to work on the scope of work around substance misuse prevention. It is one of the partners in the Public Health Network along with Parkland Medical Center, Greater Derry Community Health Services, and the Center for Life Management. So with the guidance of our host agency, Granite United Way, and with all of our partners that support the work in the community and the communities in our region, we're really trying to make a difference in finding ways to increase awareness of prevention around the many issues related to substance misuse and all the other related risk factors, and increase, our capacity in the region and also in the community of Derry to address it and to solve some of the problems that are so important relating to that.
Can you tell us your contact information for CATS? How can people get a hold of you?
Well, thank you. Yes, they can visit our website, which is catsnh.org. Also, they can call our office at 434-5251. We welcome questions. We welcome people sharing ideas and concerns, because that's how we learn and that's how we figure out how to do it together. So,
Thank you so much, Sue.
thank you. It's a great opportunity. I appreciate it. Thank you.
With me next is Donna Tai of the Public Health Advisory Council. Donna, thank you so much for speaking with us today. Can you speak to us more about what this event means to you and your organization?
Thank you. Community Health Services has been around in this community since 1989, providing services to low-income and uninsured people and connecting them with the things that they might need to get by in their lives. Many years ago, we were the first recipients of a grant from the state of New Hampshire to begin the process of starting public health infrastructure for the region. Since that time, it's evolved, and last year we were invited to provide the lead role for the Public Health Advisory Council, which is basically the oversight group for the Public Health Network. We're always looking for community members to become involved. It's a wonderful opportunity for them. Volunteerism is great in this community, so it's a huge opportunity. They can reach us through our website, which is southcentralphn.org, and they can also get an email from that address and contact us whenever they want.